Okay, so we're going to start always with the better knee or the better leg. On this client, I know it's the other knee that's giving him a problem, so it's always good to do the better side first so you can compare what's normal with your client. Okay, so we're going to warm up the whole leg with effleurage. And the shin. Heel of hand, effleurage over the muscles. And then we're going to friction round the ankle. And then round the knee attachments as well. It's a bit crunchy. Does that feel all right?
Yeah.
You might bend the knee and just work a little bit on these muscles. Just to warm them up. Not so much muscle apparent on here, it's more bone, so we're going to come up the side first. How's that?
A little bit there.
Here.
Yeah.
Breathe in and out. So we're going to trigger point this whole area like we did the calves. What number's that?
5.
Effleurage it out and then continue all the way up. And then the next one. You can also tell quite a lot about the rotation of your client's foot. We should really have a nice medial, sort of balanced foot position. The more lateral rotation we have, the more that tells us actually we've got maybe piriformis problems, gluteus maximus problems, and obviously if we've got a turning inwards medially, then that tells us that a lot of the adductors might be tight as well. So foot position is quite an indicator of where there are problems or not. So we're going to have a row up through here. Anterior tibialis, breathe in and out. So this is obviously an ankle flexor, dorsiflexor. There,
Yeah.
breathe in and out. Come up right next to the bone. Obviously you wouldn't be doing this if you had a varicose vein, you have to work above the vein, not on it or below it. See there?
Yeah, a little bit there, yeah.
Yeah, it's attachment, the upper leg muscle. So breathe in and out. Numbers that. And I'm going to come off that one and effleurage it out a bit. I might come back and do that one later or do it again if I needed to. So we've cleared that. I'm going to effleurage it out. Come up and just work around the knee. And then effleurage into the thigh. I feel this is tight. See the erythema coming to the surface, which is a red flag that there's a lack of oxygen and blood supply to this area. So, and I can also feel that it's tight in the quads. Rectus femoris is tight. What number's that? A 7 already, okay. A bit up here. Yeah. Bit of knuckling to come up the IT band. What about here? So all your movements are investigating where there's potential problems and working to pain threshold when it starts to get tight. Just going to go around the other side. Give it a bit of a twang. Oh yeah, IT band. The quads. So I'm going to just do a bit of percussion to tone it a little bit. So I know there's going to be a lot of trigger points this side, but rather than have you watch me do every one, we're going to be selective as to how many we go for. Bearing in mind this is the good leg, so I'm going to come up the IT band first. Anything?
It's okay there.
Not too bad. Okay, so coming up just here.
Yeah.
Breathe in and out. And I'm going to effleurage it out. And then come on a bit further. It's all up here, isn't it? Okay, so let's do one more on this row. There, breathe in and out. I suspect this one is probably the one. No?
Not too bad.
Not too bad.
Okay.
There.
Yeah.
That one.
Yeah.
Breathe in and out. I can feel this one's taut, like a guitar string. So if it's the gracilis, it's often a burning sensation along the gracilis if it's tight. So I'm going to loosen it up with some vibrations and effleurage to finish. So deep tissue massage, just remember, is a stepping stone from your body massage towards the sports technique. So if you're still finding yourself a little bit frustrated that you can't have more success with your leg massage, then you could always consider whether you go on and do the sports massage, which takes your treatment into another more advanced level. So you could do sports, international sports 3, then go on and do sports 4. And if you want to work with any premier football, rugby clubs, or the Olympic teams, then you need the sports 4. But if you enjoy working deeper, then you might consider that as a progression. If not, this should be more than enough for you to be able to treat any abrasions, micro abrasions and problems with the legs on most sportsmen anyway. Okay, so we're going to effleurage the shin. Just going to bend it and do some petrissage. Warm it up. Friction around the ankle. And then effleurage and friction around the knee. Especially those attachments, which again are a bit crunchy. So I'm going to start by coming up the inside. There. Breathe in and out. Just hang on to it until it's come down. Okay, I'm going to effleurage that out. And then come a bit further. There. And then the next row is coming up here. Just by the bone. That one. Breathe in and out. What number's that? Okay. The quicker they come down, the more likely they have just presented themselves, the more acute. The longer they take, the more chronic they are. So we're coming up over the anterior tibialis, just where it attaches to the bone. This is around the shin splint area as well, so if you get somebody with shin splints, the pain is often maybe a little bit more lateral, but around this area, it's shin splint pain. Effleurage it out, and now we're going to come on further. finally along the edge, going through the belly of the muscle. There. Okay, so we're going to effleurage that out and move up to the quads. Now I know this client's got a problem with the knee, so we're going to be a bit tentative about pressure initially. Let's see what we've got. So when you have knee issues, you do have to do the above and below the knee. Try and establish which muscles it is that are tight, pulling on the knee. Make sure it's not a structural, mechanical, skeletal problem. Work on the muscles first, just to rule those out. Bit tender. The rectus femoris attaches below the knee by the patella tendon. So quite often when there's knee problems, it can be the rectus femoris that's pulling on the knee. Going to warm it up well, so I can feel the muscles are tight. And go around the other side. You can't do percussion on the inside of the thigh because it's too sensitive, but it's quite a good toner for the muscles. Yeah, CIT band as well. So I would be making sure my client does a lot of stretching before and after any exercise. Just a word about couch height when you're doing a leg massage. Make sure it's on the low side rather than the high side, so that you can lean your body weight behind any moves that you do and you're not overstretching at all. Okay, so I'm just going to do some warming up forearm massage. Get a bit of erythema going into the muscle. And I'm going to start on the inside. I'm going to use the middle finger this time. It's not quite as firm as the thumb, just to make sure I'm not going to over apply the pressure. Not too bad at all. I'm not going right up into the attachment on the pubic bone. There. Breathe in and out. What number is that? So effleurage it out and then move a bit further up. Up. There. Breathe in and out. What number is that? So I haven't as yet needed to use the elbow to trigger point like you might do on the buttocks, but that's a much fleshier area, and I find the thumbs are more than enough on the legs. It's harder to pinpoint with your elbow on the legs, unless if you're going to use an elbow, you're going to come in and support it. Is that right?
Yeah.
Breathe in and out. So we're going to effleurage down. And a bit of muscle stripping with your forearm coming up through the muscle just to get everything moving. And we're going to vibrate to finish. And flick it away. Lovely, so that's it. I would recommend, if you found quite a lot of trigger points, that maybe you get your client to come back after a couple of days, give it time to recover, and get your client to do lots of stretching, apply ice or heat, whichever is more comfortable, and come back again in a couple of days to have another session to make sure that you get to all those trigger point areas.